Hi, I'm Kelsey Housman with APRS Physical Therapy West. I'm one of the vestibular physical therapists, and that simply means that I specialize in the treatment of the inner ear. Today, we're going to talk about BPPV. BPPV is the most common cause of vertigo. Patients come in complaining of vertigo, so the spinning sensation, they'll get nausea, sometimes they vomit. Imbalance is also an issue, and even a general sense of fogginess within the head. To discuss what BPPV actually is, I have this little diagram here. So basically, what we're looking at is the inner ear structure. So the inner ear is a bony structure embedded within the skull of our head. So that's why every time we move our head, this structure is stimulated. Okay, looking at the structure a little bit bigger, we have the swirly portion here that's for your hearing, and these are the semicircular canals. This side of the structure is essentially for your balance. So what happens when someone has BPPV is these little sacs within the structure hold calcium carbonate crystals. You will hear them called crystals, otoconia, otoliths. Sometimes people refer to them as marbles. What happens in the condition is they get loose. They can go within any one of these circular canals. The canals have a fluid within them that is not supposed to be in motion, but when the crystals roll around in there, it pushes the fluid around, and that gives us a false sensation of spinning. It also sends a signal to our eyes and makes the room appear like it's spinning because it creates nystagmus, which is a fast phase of the eyes. So what we do in vestibular therapy is we put people through positional testing to determine and accurately diagnose where the crystals are loose within which one of those canals. And based on where they're loose, the patient will experience different symptoms. Sometimes the spinning feels like it's going this way, sometimes it feels like it's going this way, but we diagnose based on what the eyes are doing with our video oculography goggles, where they're loose, and we perform the appropriate repositioning maneuvers to send the crystals back into place where they belong. So oftentimes people will try to Google or YouTube exercises to try and treat themselves for this. And sometimes that's a valid option, but what's most important is seeing a qualified healthcare professional, because we are able to accurately diagnose where the crystals are loose and perform the appropriate maneuver to fix it. There are 16 different maneuvers to fix this, and oftentimes the internet only shows you one particular maneuver. So it's really important to see a qualified health professional if you think you have this, and please consider one of the qualified vestibular therapists at APRS Physical Therapy.